For 7 years now, every Wednesday and Thursday, we do outreaches and deliver healthcare services to communities that live in very hard-to-reach places of Kasese, where access to healthcare services and other social services is very poor. Kasese district has quite a number of communities that live in hard-to-reach places because of the wide coverage of the slopes of Mountain Rwenzori. It takes about 90 minutes to drive on the bumpy and risky terrain before we get to any of the 5 sites in Busongora County where we implement the Safe Motherhood program. Poor access to healthcare services roots in a number of factors, including ignorance of safe and healthy practices, poor development of infrastructure, and lack of service providers. That is why our outreach intervention responded with delivery of services closer to the people and integrating 1 hour of health education talks, especially about preventable child and maternal health issues. The rains are a multiplier factor to the poor access of services for these communities. The obvious is community movement to the spot of service can be impossible, but also many of our sites have very small shelter, so the community receives services from open space and under the trees. When it rains, it is impossible to conduct the outreach normally. In a few cases, we have inevitably discontinued service for a day or even 2. Sometimes on bad days like this one, when the rains washed away the bridge, 4-wheel drive is caught up in the access hassle. And yet, for now, this Land Cruiser is the best and only means available to get the outreach team there and back. As goes the saying of a silver lining on every cloud, these difficult times are an opportunity for the communities to express their appreciation in action. They are always intensely involved in resolving hindrances. Actually, the best way to say we need your services and we are grateful you give them. They always do whatever it takes to have the problem solved. The rainy season makes some of the outreach days extremely terrible for the outreach team. One may wonder if hard to reach is not an understatement in some cases. True, trekking up the mountains is a sports activity and one would say it is good exercise, but not after the rough travel to the outreach site and a day's work in very compromised environment. And it needs to be a choice, but for this team, they either brave the hike or they find their way home the tough and rough way. The good news is that none of such incidents has deterred the team from coming again to serve these underprivileged communities. We still pray for the rains to come, but not on the day we have an outreach. Bwesumbu and Buhuhira sub-counties in Kasese district are a perfect match of the description of hard to reach. KCHEF has implemented Safe Motherhood program in these 2 sub-counties since 2018, which is 6 years now. Safe Motherhood outreach program is an integration of child and maternal health services. We have delivered sexual and reproductive health services, child immunization, antenatal care services, and HIV care services to more than 10,000 women and 10,000 children. For these communities, the nearest health center many a time is about 20 kilometers away, with no means of getting there. So the SMB intervention is a real solution. Thank you, Chera, for enabling us to serve these communities that greatly need our services. Here at KCHEF, we pledge to continue serving our community with the objective of improving their lives. Thank you.